TV에 초대를 했는데 오늘은 줌으로 인터넷 커넥션을 해보겠습니다. 최근에는 아니고 몇 년 전서부터 CDCF, Center for Disease Control Foundation, 연방 Public Health Organization이죠. 여기랑 저희가 이제 파트너십을 맺어서 우리 LA에 사시는 교민들을 위해서 코비드 백시네이션, 그 다음에 또 최근에는 독감 예방 주사를 우리 한인회에서 맞을 수 있게끔 홍보 활동을 많이 하고 있고, 실질적으로 여러분들이 한인회 오셔가지고 한국어로 이런 백시네이션을 받을 수 있는 행사들을 많이 차리고 있는데, CDCF에 계신 케이틀린 굿민슨 를 모셨습니다. 이분이 CDCF에서 이제 프로젝트 리드를 하고 계시는데, 이분을 좀 만나 뵙고 CDCF에서 정확히 뭐를 하고 있는지, 여러분들이 왜 그 코비드 에머전시가 끝나고 나서도 코비드-19 백시네이션 또 독감 예방 주사를 왜 정기적으로 맞으셔야 되는지 프로페셔널한테 한번 알아보겠습니다. 오늘 이제 인터뷰는 영어로 진행을 할 텐데 제가 밑에다가 자막을 깔아드리겠습니다. Hi, Caitlin.
Hi, James.
How
Thanks
are you?
for having me on. Doing
I haven't
well.
seen you in a while, but it's great to see you. I know you recently had a child, and you told me that he's healthy and climbing stairs and all these great things. So congratulations to you.
Thank you. Yes, he's doing great and hard to keep up with.
Yeah, I'm sure. Let's see. If you could just introduce yourself really quick, and kind of and CDCF, and tell us a little bit about what you and the organization does for our audience.
Absolutely. So as James said, my name is Caitlin Goodmanson, and I'm a senior program officer at the CDC Foundation. I work on our Partnering for Vaccine Equity program, and I've worked on that program since 2021, which is when the foundation first launched it. So the CDC Foundation is an independent nonprofit organization, and it's actually the only entity that was created by Congress to mobilize resources in support of CDC's critical. So the CDC Foundation works alongside community-based organizations across the country, like KAFLA, to help address inequities in COVID-19 and influenza coverage.
Excellent. So yeah, I wanted to talk about, it's I don't even remember how long it's been since President Biden ordered the ending of the national emergency. Obviously KAFLA has been doing a lot since February of 2020 to assist, especially Korean American folks with limited English proficiency, access testing, vaccinations when they became available, getting appointments for certain folks who had a hard time navigating different websites and such. So we brought pretty much the LA County Public Health Department to Koreatown, and so people can come and get vaccines comfortably. And for the most part, the Korean American community, I think, has been pretty good at getting vaccinated. Some people are eager to get their booster shots, but unfortunately, not everybody is like that. Some people, hear things on the radio, see things on TV, and unfortunately, there are folks out there who are, just giving out misinformation and certain things that just practically don't make sense, but when you hear enough of it, you start thinking about it. So, all this time after the pandemic has, officially or unofficially, it's officially ended, but I just feel like, especially lately, there's been a lot of folks in my group of friends and peers that have been getting diagnosed with COVID with some really bad symptoms. So why do you think, as an expert, it's still important to get vaccinated and keep up with your boosters?
Yeah, that's a great question. I know that we are all so tired of hearing about COVID-19. As you just mentioned, James, you all have been working in COVID-19 for 4 years, right? I think many of us are tired of it, but unfortunately the virus is still out there and it's still spreading in our communities. People are still going to the hospital. Some people are still dying. And so I know we want to just move on with our lives. And so the best way to do that and protect ourselves and our loved ones is to make sure that we get vaccinated and stay up to date on our vaccines. Since viruses change and mutate, it's really important to get the most up-to-date vaccine. So if you got vaccinated back in 2021, that's great. but you need to keep getting the most up-to-date formula. That's the best way to remind your immune system how to fight COVID-19. And the newest vaccines are actually more effective at fighting the variants that are currently circulating. We're seeing that the updated vaccine formula that's currently available is doing a really good job of protecting people against the vaccines that are, or the variants, that are circulating right now. So that vaccine became available in the fall. And so we've got some real world data now on that booster, that updated vaccine being effective against what's circulating. Finally, I'll mention that we saw 20,000 hospitalizations and 2,000 deaths per week at the COVID peak this past winter. So the vast majority of those hospitalizations and deaths were among people who were not up to date on their vaccines. So it really is important to be able to keep ourselves healthy, to make sure that we're getting the updated vaccine, and it just kind of becomes part of our routine, right? We know that when that updated vaccine is ready, we go ahead and get that next shot.
Thank you. So before we got on the call, I was reviewing some LA County Health Department statistics, and it shows that a lot of the infections of COVID, hospitalizations and deaths actually occurred in low-income neighborhoods. When you think about low-income neighborhoods, a lot of them are, high immigrant population folks, such as Koreatown here in Los Angeles. And although a lot of people do businesses in Koreatown are very successful, Koreatown in its entirety is considered a low-income district in the city of Los Angeles. So we're definitely seeing a lot of infection rates here. And I think we can attribute a lot of that to the fact that there's limited language resources. A lot of folks who are not language efficient in English have a hard time booking appointments. They kind of worry about going to pharmacies because they're afraid that there's going to be a language barrier there. And so KAFLA has been trying really hard for the last few years to make sure that we offer services in language so that people who might not be comfortable with the English language can have can readily access these services. And so earlier I was telling you that there's a lot of we're living in the age of social media, right? So every time you turn on your phone, we're on Facebook, Instagram. These days it's TikTok. I mean, we don't know how long TikTok's going to last, but there's a lot of misinformation out there. So could you tell me, what are some of the myths that are still kind of going around in the United States about the COVID-19 vaccine?
Yeah, absolutely. And that has been such a challenge, right? The misinformation and the myths, I know, are hard for us. It's hard for you. But I think the myth that we hear the most often is that people think that the COVID-19 vaccines aren't effective. Of course, you can still get COVID-19 if you've been vaccinated, but having that immunity from vaccines tends to make illness just so much less severe for people. The vaccines are helping keep people out of the hospital and can make the experience of getting infected with COVID-19 much less miserable. So if you ask me, that's really effective. If you're up to date on vaccines, it improves your chance of fighting the virus and not getting sick at all, but then makes the experience much less painful if you do get it. I'll also mention that the Partnering for Vaccine Equity program is constantly listening to the myths and the misinformation that's circulating online and developing responses and information that's based on science. So you can visit the Vaccine Resource Hub, which you can find that online at vaccineresourcehub.org to find the most up-to-date information about COVID-19 and influenza vaccines. Another myth that I'll just mention since we're on the topic is that, people think that the COVID-19 vaccine isn't safe. And at this point, we have seen hundreds of millions of COVID-19 vaccine doses administered in the United States with very few side effects. So these vaccines are well tested. And, since people are so much more likely to go to the hospital if they're not vaccinated, it's clear that the benefits really outweigh the risks with getting vaccinated.
Yeah, on that note, I think, we as human beings have a tendency to take, if there's a million cases, like you said, or hundreds of millions of cases, And if there's one or two bad things that happen, that kind of becomes the main story instead of all the other successful
Right.
cases where, folks got it, maybe got diagnosed with COVID-19 a little bit later, but then the side effects were just not as bad as had they not taken the vaccine. You mentioned influenza earlier. So, we lately have been, it was flu season, and I know I got sick. A lot of my friends got sick. We've been hosting bi-monthly COVID-19 and influenza vaccine pop-ups. We were so busy and the demand was so high that I personally did not get influenza vaccine. I got sick.
Oh, no.
And the symptoms were so bad. And so I know firsthand how important it is to get your flu vaccine every year. Could you tell me a little bit about why getting the influenza vaccine is just as important as getting updated COVID-19 booster shots?
Absolutely. So just like the COVID-19 virus, the flu virus is constantly changing and mutating. And so each year, scientists develop a vaccine to fight the flu. So it's important to get that vaccine each year, right? It's an updated formula. So it's similar to staying up to date on your COVID-19 vaccine. Getting that annual flu vaccine is the best way to equip your immune system to fight influenza if and when it sees that virus. And you can actually get your COVID-19 and your influenza vaccines co-administered. You can get them administered at the same time. And so that makes things a little bit easier. If you go in for an updated COVID-19 vaccine, you can say, hey, I'll get my flu shot while I'm here, and just make sure that becomes part of your routine.
Yeah, funny you mentioned you can get them both at the same time, because every time we do a vaccination clinic, we offer both shots. And so, people, they don't want to keep coming here. They want to just one shot, two birds, one stone. And, the nurses will ask you, what side would you like your COVID-19 booster shot on? And if you say left, actually, you can put the influenza on your right, and boom, 5 minutes and you're out of here. So I think it's really easy to do so. But I think, certain people just kind of get lazy. They don't want to make an appointment. They don't want to go to the pharmacy, wait in line. So, we here at KAFLA have made it very easy. We are on average hosting one COVID-19 influenza vaccine event every 2 months, right here in the comfort of Koreatown. So, kind of a plug here for our next event. We have a COVID-19 and influenza vaccine event this coming March 27th. From 10 a.m. to 2 p.m. for 4 hours. You can make an appointment with us, come in and get your COVID-19 booster shot or your influenza vaccine. So I'm gonna pop the flyer right here. If you guys see my finger, I'm gonna put the event flyer right here. 여러분들이 이제 그 생활을 사시면서 매일 이제 출근도 하시고 바쁘실 텐데, 한국어로 편리하게 한인타운에서 여러분들이 코비드-19 부스터샷이랑 독감 예방주사를 맞을 수 있게끔 저희가 거의 한 2달에 한 번씩 이런 행사들을 하고 있습니다. 그래서 주저하지 마시고 저희한테 전화를 해주셔서 그 예약을 하시면 여기 오셔가지고 한 30분 안에 2개 다 맞으실 수가 있고, 아니면 뭐 코비드-19 부스터만 맞고 싶다, 독감 예방 주사만 맞고 싶다, 그러면 뭐 둘 중에 하나, 아니면 같이 맞으셔서 뭐 아침에 출근하실 분들은 출근하시고 저희가 편리하게 만들었으니까 요번 돌아오는 3월 27일 날, 다음 주죠, 꼭 예약을 하시고 부스터나 독감 예방 주사가 필요하시면 꼭 예약을 해주시기 바랍니다. Caitlin, thank you so much.
Thank you, James.
Yeah, were there any parting words that you would like to leave our audience with before we go?
Sure. Just again, thank you so much for having me on today, and thank you to James and everyone at KAFLA who's just doing this amazing work in Los Angeles. At the foundation, we love working with KAFLA and are really proud of the efforts. And I've actually been to visit the office, so I've seen firsthand, the great work that's being done there, and we really appreciate it. So to the audience, I hope that you'll get your updated COVID-19 vaccine, and make sure that you get your flu shot every year and just stay up to date on your vaccines to protect yourself and your family and your community. Thanks.
Thank you so much. And I did want to, and I almost forgot to mention that despite the end of the federal pandemic phase, through a program called the Bridge Access Program, COVID-19 vaccine shots and boosters are still free of charge, at least here in LA County and at Korean American Federation of Los Angeles. So 독감 예방 주사나 COVID-19이 지금 이제 연방에서 그 팬데믹 그 기간이 끝나고 뉴스에서 뭐 이제 COVID-19 부스터를 이제 돈을 내야 된다는 얘기를 했지만 브리지 액세스라는 프로그램을 통해서 아직도 저희 LA 카운티에서는 무료로 이거를 받을 수가 있기 때문에 돈을 안 내셔도 됩니다. 보험 있으신 분들은 보험 카드를 갖고 오셔야 되겠지만 보험이 없으신 분들이 워낙 많기 때문에 여러분들은 아직도 무료로 백신을 맞으실 수 있으니까 다음 주 27일 날에 백신이 필요하신 분들은 꼭 와주시기 바랍니다. Kaylin, thank you so much for today's interview. Hopefully I will get to see you again soon. But in the meantime, take care of yourself, and we really appreciate today's interview.
Thanks, James. Great to see you.
Thank you. Bye-bye.
Bye.